Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is our first webinar of 2021. Good to be back here with everyone again, and I look forward to see what we can do to help you with your Lyme disease tonight. For those of you that are new here, basically the way you participate is two ways. You can write questions to me, and you do that there's a chat box over on the right-hand side of the screen at the bottom. You can write your question to me through that chat box. Be aware that every time you hit the enter key, it sends a separate question to me. So I ask that you only hit the enter key when the whole thing is done. Okay. Also, be aware this format really works well for short questions. If they get to be too long, I won't answer them. So try to be brief with what your question is too. I will not be able to get through all the questions tonight. I never am able to, but I'll get through as many as I possibly can. And usually I have an answer for you, but sometimes you stump me. So I'm interested to see how you might stump me tonight too. These are complex illnesses we deal with, and I don't have all the answers for everything. I am creating a recording of the webinar tonight. And tomorrow morning, somewhere around, probably around 9 to 9:30 a.m., you'll get an email from me with information about how to see that video, but be aware that tomorrow morning you'll be able to do that. If you happen to miss that video, you can find a copy of the webinar recording on the webinars page at treatlyme.net. That's my Treat Lyme by Marty Ross MD site. You can also find it at my supplement store, which is Marty Ross MD Supplements on the front page, and that is treatlyme.com. Okay. You can even find it on my practice website, which is martyrossmd.com. So I have it all over the place. So if you somehow miss that email, you can find it other ways too. Okay. And then let's see here. Oh, during the webinar tonight, I will read the questions. For those of you that are participating in the live version, in other words, not like right now, you're participating, you will actually be able to see those posted on your screen. In the recorded version, it does not show up. Okay. All right. So without any further ado, let's go ahead and take the first question here. Hello, Cystitis. Happy New Year, Dr. Ross. What do you think of the salt seed protocol for Lyme and co-infections? It's an interesting idea. I don't think it really works that well. And there was one time, probably about, I've been doing this, treating chronic Lyme since 2004. So there's all these fads that go on in the world of Lyme disease. And the reason we get so many different fad treatments is it's a difficult illness to treat. So people are willing to try a lot of different things. Generally, there was a phase maybe about 10 years ago where a lot of people were trying salt seed protocols. And what I can tell you is the majority of people don't get benefit from it. So that's one thing I would say. Secondly, if you're a person with high blood pressure, it's not a good idea to do the salt seed protocol because the high salt content of the salt C protocol, that's table salt and vitamin C protocol. The high salt content can lead to high blood pressure. So it's probably not a good idea for that reason as well, too. Okay. So I don't advocate it. I don't recommend it for anyone. I generally think it's a waste of time and a waste of resources. All right. All right. Thanks for your questions, and good luck to you. Hello, Helen. Let's see. May I ask my question here? The answer is yes. I bet I see your question coming up here soon. Hello, Elizabeth. Let's see. Good evening, Dr. Ross. Good evening to you. Let's see. I am waiting for the results of my latest test through IGeneX for a status update on Lyme and 4 other tick-borne diseases I've been battling for the past 3.5 years. I have arthritis in my left shoulder that I believe has been exacerbated by Lyme bacteria. My joint is rubbing bone on bone. 2 orthopedic surgeons have recommended a full shoulder replacement. I am wondering if any of the tick-borne diseases are still in my system. Would you recommend going ahead with the surgery? Thanks for your advice, Elizabeth. So, Elizabeth, if Lyme is active in you, often, not all the time, but often when people get general anesthesia, and by general anesthesia, I mean the type of anesthesia where there is an anesthesiologist in the room and they put a breathing tube down your throat and you breathe in anesthetic gas. Okay. So the other kind of anesthesia you can get is a type of anesthesia where they sedate you by putting IV medicine in. Sometimes we call that conscious sedation, even though you're not conscious. But the kind where they do the general anesthesia, where you breathe the stuff in, there are times that that I see, and I know a number of my colleagues see, that people with Lyme, actually their symptoms seem to get worse. We don't know why, but general anesthesia somehow seems to make it so that Lyme can get more active, okay? But if your Lyme is under control, then the chances probably are you're going to do fine. And even if your Lyme is under control, but you got to get your surgery done, I would still go forward with it. Just realize you may have a little bit of a flare of your Lyme. Afterwards, it tends to be short-lived, maybe a month or two or so, okay? But if you got to get surgery done, you got to get surgery done, okay? All right. So that's one thing. Number two, you may be aware, or people attending my webinars should be aware, I am in total disagreement with all of my colleagues who keep wasting your money retesting to see where you are in your Lyme treatment. There is not a test that tells you if you're getting better. There is not a test that tells you if you are done. So keep in mind the testing that people are doing is either this elispot test by Armin Labs, or they're repeating Western blot test. Okay. Both the elispot and the Western blot are immune reactivity tests. They're trying to see how reactive is your immune system. Does your immune system have show evidence that it has tried to deal with Lyme before? Okay, right. Now, they will say if you're less immune reactive, meaning your elispot is less strong, or your Western blot or immunoblot is less strong, that somehow that means the germ is under control. All right. Well, the truth is, it could be that the germ is more out of control. And the reason the germ could be more out of control is sometimes Lyme suppresses the immune system. All right. So when Lyme is active in you, it can suppress the immune system. So getting a negative Western blot or a negative elispot after you have been treated for Lyme does not tell you if the germ is gone. It just says your immune system isn't reactive. It could be not reactive because of immune suppression from active Lyme, or it could be less reactive because the germ is out of you, but we really don't know. So people are repeatedly wasting your money by trying to get repeat testing done. And I don't understand why my colleagues are doing this. I would wish some of them would show me a study that tells me that following your elispots and following the Western blot or immunoblot gives any evidence that there is a lower germ load in you. And they can't send those studies because no one's done such a study, okay? So I plead with all of you, stop wasting your money to try to get some evidence that you're doing better with your Lyme treatment, because it gives you false information. It's not adequate information. So anyhow, I just want to point that out to you too, okay? I have a whole article I've written about this. So if you want to read about this a little bit more, let me do a quick screen share here and I'll show that to you. All right, let's see here. All right, so this is my Lyme site, okay? And I just got to put up here test. Well, hold on a minute. I know I've got. I see where I put this. Let me look into this page here. Here it is. So this is the article. It's called Repeat Lyme and Co-Infection Testing to Check Treatment Status is Not Valid. Stop wasting your money. All right, there you go. Good luck to you, Elizabeth. Hello, Jimmy. Let's see. My son has not responded to anything. IV antibiotics, supplements, etc. The theory is now autoimmune. How do you deal with this when antibiotics and holistic remedies don't work? So first of all, there's many reasons that people may not recover from Lyme. One is maybe it's the wrong diagnosis. Could be. Sometimes just having a Lyme test that's positive does not necessarily mean Lyme is causing your problem. Okay, so we always have to reevaluate, are we treating the right thing? Okay. Number two, when people are not getting better, we have to look at other things that may be causing a similar situation that looks like Lyme. So when you have Lyme, the main reason you feel badly is these germs that are in you trigger the immune system to manufacture inflammatory chemicals called cytokines. Cytokines are good and bad. On the good side, they turn the immune system on. But on the bad side, when they're made in excess, because the immune system isn't doing a good job, sometimes it tries harder and harder, and eventually it makes too many cytokines. Too many cytokines make it so you can't think, make you hurt all over, give you severe fatigue, interfere with how your hormonal systems work, disturb your sleep, make you hurt, give you joint pain, give you confusion. Okay, all those symptoms that we call Lyme symptoms are actually excess cytokine symptoms. So if I'm treating somebody that I've used antibiotics on and they're not getting better, I'm starting to wonder what else is triggering cytokines here. The two big things to consider, and I hope your doctors have looked at this, is one, if by being on antibiotics, you've suddenly developed too many yeast living in your intestines, those yeast that grow too much in your intestines from you being on antibiotics trigger cytokines. So you can make it look like you're not getting better because you got too many yeast triggering cytokines, okay? Second thing, when somebody's not responding at all to treatment, you got to start wondering, could they have mold toxicity? Which is a separate problem, but keep in mind, 25% of all people, whether they have Lyme or don't have Lyme, have a genetic predisposition where they are programmed in a way that once they breathe in a mold toxin from the world around them, they can't get rid of it. And if those mold toxins are trapped in you, in your blood, they trigger cytokines. And it can be as bad of a situation as what Lyme is, okay? So I don't know, but I'll just throw it out. Your doctors ought to be sure that they look to see if you have too many yeast and considered it, and also for your son, that is. And then they also should have done at least some urine testing to see, does your son have mold toxins? Okay, so I hope that they have considered all of that, okay? All right. The last thing to consider before I fully answer your question here is when people aren't getting better, you got to wonder what co-infection is there that I missed. All right. And I miss them too sometimes, right? So the problem with co-infections is our testing for Bartonella co-infection and our testing for Babesia co-infection is not always accurate. And so you can have co-infections in you and have negative testing. Some doctors make the mistake of not treating for Bartonella or not treating for Babesia if the testing is negative. What really needs to be done is to consider, could they be there blocking treatment? And the way you make a decision about whether they could be there is you can do the testing. And if it comes back positive, yeah, definitely treat. But if the testing comes back negative, you still have to consider, could you have Babesia or could you have Bartonella? And so what you would want to do to help figure that out is look at what the symptoms tell you, okay? So things that make you think of Babesia are drenching night sweats, air hunger, feeling like you can't get enough air in from time to time, having a lot of headaches in the front of the head, having a lot of blood pressure instability, where your blood pressure is up and then it drops, or you stand up and you get faint really easily, okay? Racing and skipping of the heart. Those are things that make you think of Babesia, all right? Things that make you think of Bartonella are a lot of pain on the soles of the feet. Air hunger too. Air hunger can occur in both Babesia and in Bartonella, okay? In both of those. Also for Bartonella triggers a lot of psychiatric issues. So people can have depression, anxiety, all right? Hallucinations, terrible thinking sometimes indicates Bartonella, although Lyme can cause that too. And then finally, Bartonella also tends to give people a lot of neurologic symptoms. So tremors, shaking, feel like you're buzzing or vibrating on the inside, numbness. Those are things that make you wonder, could Bartonella be there? Okay, so I hope your doctors have adequately considered whether there's Bartonella or Babesia in your son as well too, okay? All right. Now, in terms of autoimmune illness, if it is autoimmune illness that has been triggered by Lyme, there is one type of treatment that can be helpful, and that is to consider using something called low-dose naltrexone. So naltrexone, many of you may be aware of, is as a drug we use in people that have narcotic overdoses, all right? Because what it's manufactured to do is to actually be used in narcotic overdose because it can bump narcotics off of narcotic and endorphin receptors in our bodies, getting rid of their terrible effects, okay? But we have a system in our body, our own natural pain system, made up of chemicals called endorphins. And endorphins regulate pain in us, but they also regulate the immune system. And what we can do is use these narcotic endorphin blockers called naltrexone, and we can block endorphin receptors. And what happens when we do that, two things. Number one, brain doesn't like it. Brain tries to maintain steady levels of things in our body. And if it senses that those endorphin receptors are being blocked, it sends out a bunch of chemical signals to endorphin producing cells in the body and says, make more endorphins, okay? So the act of blocking your endorphin receptors with naltrexone causes more endorphins to be made. Okay. Number two, those endorphin receptors become more sensitive to any remaining endorphins out there. All right. So what happens is that about 4 to 6 hours after the naltrexone wears off, these endorphin receptors get flooded with extra endorphins, and they're more sensitive to those endorphins. And it has the effect of regulating and balancing immune systems that are triggering autoimmune illness. All right. Now, when we use it as something called low-dose naltrexone. And so naltrexone is manufactured as a 50 milligram pill. The reason we call it low dose is we try to use it somewhere between 1.5 and 4.5 milligrams a day. The reason we use it at low doses is we want to make sure that it actually wears off at about 4 to 6 hours. If you did a 50 milligram dose, it would never unblock the receptors if you kept dosing it every day. If you do a 1.5 to 4.5 milligram dose, what happens is it does wear off of the receptors at about 4 to 6 hours, and then you can get the benefit of it, okay? So you may want to consider that as well too, all right? Regarding your son, number one, consider, did they treat all the infections? Make sure there isn't Babesia, Bartonella there based on symptoms, even if testing is negative. If they are there, and there's a possibility there, they should be treated, okay? Number two, look to see if there's too many yeast triggering cytokines. Number three, look to see if there's mold toxicity triggering cytokines. And then in terms of how do you regulate for autoimmune illness, look at low dose naltrexone. Okay. So let me do a screen share. I'm going to show you some articles that you can take a look at. Okay. So this is back at Treat Lyme, my Lyme disease information site. In terms of naltrexone, you can find it in an article about it in my immune system chapter. And it's this article right here called LDN, low dose naltrexone for Lyme. Okay. All right. Now I want you to be aware, I describe in more detail how to use it here. And I also want to let you know you're going to need to give it a good 4 to 6 months to see if it's going to make a difference. Okay, so that's one thing. Right. The other thing I just want to show you is how do you figure out if you have Babesia or Bartonella? Well, take a look at my section here called How to Diagnose. And take a look at this article called How to Diagnose Bartonella. And then take a look at another one called How to Diagnose Babesia. And in both of those, I go through the symptoms to consider that could suggest that you have those. Okay, all right. All right. And then finally, 2 more articles in terms of mold toxin illness and how you diagnose it and how do you treat it. You can find information about that in my detoxification section. And it's this article here. And then finally, for yeast, how do you know if you might have yeast? Take a look at my yeast section and look at this article here called A Silent Problem, Is It Yeast? And if you think you have yeast, then here's the treatments over here in this article called Kills Yeast, a Brief Guide. Okay? All right, Jimmy, good luck with your son. Hello, Helen. Let's see. Are shortness of breath, chest pains when walking up slight incline, swollen gums, red cheeks, burning sensations in the thighs and feet signs of Babesia? I have, let's see, there's a second part here. I have had Lyme for 12 years and I have not had these symptoms before. And if what can help LDN, I'm not sure what you mean by that. And I had just talked about LDN, which is low dose naltrexone. So I would point you to that article, see if that gives you information. Okay. And then in terms back to your original part of the question, are shortness of breath, chest pains when walking up a slight incline, swollen gums, red cheeks, burning sensations in the side and feet, signs of Babesia? The only one that might be is shortness of breath, but usually that is something that occurs, the air hunger that occurs in Babesia is while you're at rest. Okay. So these symptoms you're having, I don't have enough clues in here to say what it is exactly. If I had a chance to talk with you more directly, I'd ask you a lot more questions and try to tease out what's going on. But from what you've written down here, I can't tell. Okay. All right. Hello, Thomas. Let's see. Any suggestions for bladder incontinence and increased urine frequency and inability to retain urine for more than 10 minutes? Looks like bladder wall is twice as thick from scar tissue, causing rigidity from long-term infection. What was your experience with chronic fatigue syndrome? I unfortunately have had chronic fatigue before I got bit by a tick and contracted Lyme and co-infection. So I got the double whammy. Okay. So, Thomas, let me just talk about bladder and what can give bladder symptoms. So everyone, bladder, so urinary frequency, going more often, inability to retain urine, sometimes having burning on urination, and sometimes feeling like you got to pee a lot are symptoms that sometimes can happen in Lyme and in the infection Bartonella due to a condition they trigger called interstitial cystitis, which means inflammation of the bladder, which could lead to scarring, like you're describing. It may not all be from medications. It could actually be from the infections, actually, okay? And and this is different than like a regular bacteria bladder infection. This is a Bartonella Lyme situation. So first of all, I hope that somebody has looked at your urine to figure out, do you have a regular bladder infection? I assume they have from what you've described here, okay? They may have also looked in your bladder, and sometimes this condition called interstitial cystitis, you can actually see if you look inside the bladder with a fiber optic scope, sometimes you can actually see changes in the lining of the bladder that suggest that's what's going on, but not all the time. So what is helpful is to try to get if this is interstitial cystitis, what is helpful is to get the inflammation in the lining of the bladder wall to decrease and to protect further irritation of all that of the bladder wall by blocking urine's ability, the acidic nature of urine to irritate that lining too, okay? And so what works for that is quercetin, which is a substance that's found high quantities in onions, but also in colorful fruits and vegetables. Quercetin is a bioflavonoid that can decrease cytokine inflammation, especially in the bladder lining, okay? The other thing that's helpful is to line the bladder with some glucosamine sulfate. Now, many of you may be familiar with glucosamine sulfate. It's actually used to rebuild cartilage in the knees. It's a building block for cartilage. But in the bladder, it actually it can help form a microscopic gelatinous coat that covers the bladder lining to keep urine from further inflaming it and irritating it, okay? So there's two ways you can do it. Number one, you could get quercetin and you could get glucosamine sulfate as separate supplements. If you were to do that to see if it's going to work, get the Thorn quercetin and get the Thorn glucosamine sulfate. And the reason I recommend that is if you're going to try to see if this is going to work, don't waste your money with supplements that who knows if they're going to work, okay? You want to make sure you're using products that are known to be good quality. And there's a lot of garbage products out there. In fact, The New York Attorney General and others have gone in to study places like Target and Costco and other places, and they found like about 40% of them had ingredients in them that weren't on the label, and that about 40% of them also did not have things in them that the label said was in them. Okay, these are supposed to be good products, all right? So like at my supplement store, I've tried to do a good job of choosing products that have good verification that what is in them actually is in them, and products that I know have worked in my practice. All right, I'll show you my supplement store. If you're wondering what brands do I recommend, I'll show you my supplement store here in a minute. Okay, so the quercetin you would do as a 250 milligram pill, 2 pills 3 times a day. And the glucosamine is a 500 milligram pill 3 times a day. All right, that's one way to get both of those in. The other option is to use a product made by a company called Vitanica, which is called Bladder Ease. And it has pills that have the quercetin and glucosamine together. And you would wind up actually doing 4 of those pills 3 times a day to get adequate dosing in. Okay, so that's something for you to consider trying. Okay, then to answer the other part of your question regarding fatigue. So, Lyme can lead to fatigue, and I understand it sounds like you had fatigue and then you got Lyme and got more fatigue. But an underlying situation to think of that can happen in both Lyme and in chronic fatigue that can leave you fatigued even after you've done all your antibiotics and everything, and it's something that occurs in both Lyme and in chronic fatigue syndrome, is there can be what is known as mitochondria dysfunction. So every one of your cells has an energy factory system in them called mitochondria, okay? And every one of our cells has about 300 to 400 mitochondria. Inside mitochondria, sugar and fat are burned through a bunch of chemical reactions to create a type of cell fuel called ATP. Now, when you have chronic infection in you, oxidizing agents that get made by the immune system to deal with the germs damage the mitochondria, okay? Right. If you have chronic fatigue syndrome, perhaps because there's increased oxidizing agents for other reasons, you may have mitochondria dysfunction too. So one thing to consider for this ongoing fatigue is to fix your mitochondria, okay? And so there's a number of things to consider to do that. And what I'm about ready to talk about here, I have written down in an article. I'll show that to you, okay? So first of all, you want to repair the covering of the mitochondria. And so we need to use products that have the fats in them that repair those fat membranes of the mitochondria. And so what I like using is a product called ATP 360, manufactured by Research Nutritionals, and that's 3 pills 1 time a day. Now, if you are being treated for Babesia with atovaquone, malorone, or mepron, you do not want to take the ATP 360 because one of the things it has in it, in addition to the fats, is coenzyme Q10. And CoQ10 can interfere with your atovaquone found in malorone and mepron. Okay. If that's the situation, then instead of doing ATP 360, you would want to do a product by Research Nutritionals called NT Factor that doesn't have any CoQ10 in it. And you would do that as 2 pills 3 times a day. Okay. So number 1, fix your mitochondria membrane. Number 2, you need to be on a good antioxidant that can help repair the mitochondria from the inside. And what I like to use to do that is glutathione. Glutathione is the master antioxidant that's made in every one of our cells, and it's used to repair cell damage and mitochondria damage, okay? And so it can, if cells have been trying to fix themselves, they'll burn out their supply, so you need to give them more. And so the product I like for liposomal glutathione, the reason we use liposomal is it increases its absorption. And the product I like for that is a product called Trifortify by a company named Research Nutritionals, okay? And you would do a teaspoon of that 1 time a day, all right? If you are vegetarian, you also should supplement something else, which is a product called carnitine, also known as acetyl L-carnitine. And that's a 500 milligram pill 1 time a day. If you're a vegetarian, you don't get enough carnitine. You get carnitine from red meat. And if you're vegetarian, you're not going to get carnitine. You need carnitine because carnitine is used to carry fat to the inside of mitochondria so it can be burned into cell fuel. Okay. All right. And finally, if you really want to do the whole full court press, the fourth thing you would do is to take coenzyme Q10. Even though there's a little bit in the ATP 360, it's just a small amount. CoQ10 is used to carry electrons around your mitochondria, and we need to carry them around so you get better energy generation, okay? And you would do 400 milligrams 2 times a day, all right? So I've said a lot of stuff. Let me point you in the direction where you can take a look at this, okay? All right, so let's go back to my information site. Actually, before we go there, so as many of you know, I have my own supplement store. And the reason I have a supplement store is so my patients can reorder their supplements. But also, I wanted it to be a source that anyone could find high quality, okay? And these are products I have selected based on them being high quality and what I call physician grade supplements, okay? Now, if you're wondering, what quercetin would Dr. Ross recommend? Go ahead and type quercetin up here and see what comes up. Okay, you'll see a few products, but the main one is this one called, by Thorne, called quercetin, all right? If you're wondering what brands do I recommend, look over here. This is all the manufacturers that I carry. These are what I consider to be physician grade, pharmaceutical quality, if you will, that have a better chance of working because they really do have the active ingredients in them that they say they have in them, okay? These are also manufacturers that tend to do a good job of sourcing their ingredients to find the most active ones available, all right? Okay, so anyhow, anyone could buy from this supplement store, although my patients use it, anyone can buy from here. And keep in mind, you don't pay taxes when you order from me because I cover those. And we offer free shipping for anything over $50, okay? All right. Then, in terms of your mitochondria, take a look at my section called Energy and Fatigue. And then here's the article called How to Fix Mitochondria and Get Energy in Lyme Disease. It's the same information if you have chronic fatigue syndrome too, okay? So I'd take a look at that as well. I'm trying to think if there was anything else I wanted to show you here. Bear with me a minute. Let's see, what was that question again? Oh, that's right. In terms of the bladder issue that you're having and what to do, take a look at my section called Bladder. And here's my article on interstitial cystitis, okay? All right. All right, Thomas, good luck to you. Hello, Heather. Hi, Dr. Ross. Thanks so much for these. You're welcome. Let's see, I found out that I am HLA-B27 positive associated with reactive arthritis and ankylosing spondylitis. How worried should I be about this? Also, if it is an autoimmune problem, could taking immune stimulant herbs like cat's claw and noni be making me worse? Also, do you know what the gene is associated with not being able to, do you know what gene, which gene is associated with not being able to detox mold? So regarding the genetic profile testing you would look at for mold detoxification, there's a blood test called an HLA-DR profile that you would get. The thing is, you can look to see if you have the profile, but some people have problems detoxing mold that don't even have the genetic profile, okay? So anyhow, just that, okay? Now, in terms of ankylosing spondylitis and autoimmune illnesses being triggered by a cat's claw noni, I've never seen it to happen. And I've used the cat's claw in people that have autoimmune illnesses, and I don't see a problem using that, okay? So anyway, those would be my comments on that. All right. Good luck to you, Heather. Hello, Brandy. Let's see. What was your experience with chronic fatigue syndrome? I unfortunately had chronic fatigue before I got bit by, oh, I think I answered this one already. Or maybe this is a different person asking a similar question. Say, I unfortunately had chronic fatigue before I got bit by a tick and is the mechanism or deficiency that BART uses to cause psychiatric issues. Is there any recommended support? Even just a 10-minute burst of direct sunlight makes me exhausted and heart palpitations that might have you seen that before, like the immune system gets ramped up and won't stop until something runs out. So I think you've built a few questions in here. So in terms of the chronic fatigue syndrome, again, the main point I would raise is to try to fix your mitochondria, okay? Other things that work for chronic fatigue are also similar things that I build into my Ross Support Protocol for Lyme, which is get sleep, lower inflammation cytokines, correct your hormonal disturbances like your adrenals and your thyroid, get mold toxins out if they're there, fix your mitochondria, treat chronic infections like yeast and Lyme, okay? So I built all that into my Ross Lyme Support Protocol. I'll show that to you here in a minute. Those are similar steps that you would take if you have Lyme, okay? But also keep in mind doing the mitochondria repair that I pointed out earlier tonight, okay? In terms of a mechanism by which Bartonella leads to psychiatric issues, we think we're not 100% clear. We do know it does happen. The chemical that may be related to it is the cytokines that I've talked about earlier tonight. So sometimes if you do things to control cytokines, that can help, not always. Ultimately, you got to get the germ out, okay? And then in terms of your sun sensitivities, I'm not sure what to make of that, all right? Okay, so let me just do a quick screen share here. Okay, so in terms of steps to do in chronic fatigue and fibromyalgia and in Lyme, take a look at my treatment protocol here. And while this targets Lyme, these are similar steps or the same steps you would do for chronic fatigue and fibromyalgia, all right? So first of all, one of the things I talk about in here is before you do anything, make sure it's not mold toxin illness, okay? All right. All right. And then the other things you need to do is make sure you're getting 7 to 9 hours of sleep. And I talked to you about how to do that here. Number 2, I like people being on a paleo type diet because it supports your mitochondria. And I mentioned that here. Okay. Number 3, lower your inflammation cytokines. Number 4, be on something that supports your body to deal with stress. I like using the herb called ashwagandha. Number 5, take care of looking to see if you might have hormonal issues and fix them. Be on a good multivitamin. Do things to support detox, like being on glutathione. Exercise if you can. I don't put people on specific immune boosters because doing sleep, diet changes, cytokine control, working with an adaptogen, fixing your hormones, being a good multivitamin, detoxing, and exercising if you can, help turn your immune system on, okay? All right. Make sure yeast is there, and if it is, get rid of it. And then if you have Lyme, treat it. If you have co-infections, treat them, okay? So those are the key steps that are similar in the protocol for whether you have Lyme, chronic fatigue, or fibromyalgia, all right? Good luck to you, Randy. Hello, Diana. Thank you, Dr. Ross. My question is about surgery for a patient who has Lyme, Babesia, and anaplasma. I am scheduled for a hip replacement. Can I expect any complications from the surgery if I still have these diseases at the time of surgery? I am undergoing disulfiram treatment now, but I don't expect to be disease-free by the time of surgery. Can you advise me? Should I delay surgery, etc.? So again, I raised the point again earlier. Somebody had asked me about shoulder surgery. It's the same point. which is a surgery when you get general anesthesia. And I described what I mean by general anesthesia in that answer earlier, can sometimes flare up Lyme. It doesn't preclude you from getting the surgery done, but be aware you may see some flare for about a month or two after the surgery. Okay? All right. Good luck to you. Hello, Geraldine. Let's see. What do you think of Buehner Protocol, cat's claw, Japanese knotweed, Siberian ginseng, astragalus, only for early stage, and possibly endographis? All right. So, the Buehner Protocol I have worked with. I prefer my own protocol. I find it to work better. Buehner addresses the same things I address in my protocol, which is do things that ultimately help your immune system work better. And in my protocol, I address them by getting sleep, supporting your hormonal systems, etc. Okay. Buehner also has things in it that kill the germ. So he uses cat's claw and the endographis. In terms of killers of Lyme, I prefer cat's claw and otobabark. I think they work better than the cat's claw endographis combination that he recommends. The knotweed that is in his protocol has some antibiotic properties, but it's very weak. And the knotweed that's in there also is used to lower inflammation cytokines. I find that the curcumin I recommend does a better job. Okay. So anyhow, I think you'll do better if you follow the kind of all herbal protocol I recommend in the treatment protocol. There's herb selections for every one of those points I raise. I think you'll do better than the Buehner protocol by following that. Okay. All right. Good luck to you. Hello, Tomas. Let's see. Hello, Dr. Ross. Happy New Year to you. Thank you. And you too. Let's see. I am Borrelia and Bartonella positive and Babesia negative on an elispot. I believe some of my symptoms, such as insomnia, sore soles, bone pain, neuropathy, relate to Bartonella, but I also have severe neuropathic stomach pain, burning skin, and yellow stool. Could I also have Babesia? Thank you. So, the symptoms you're suggesting here are not what I would call Babesia symptoms. Yes, the sore soles, even bone pain can be part of Bartonella. Neuropathy definitely can be part of Bartonella, okay? But the neuropathic stomach pain also can be Bartonella, and the burning skin from nerve injury can be part of Bartonella. Yellow stool, that's kind of a non-specific symptom. It doesn't tell me anything, actually, okay? The Borrelia, keep in mind, Lyme, Borrelia, can also give you a lot of the neurologic issues as well, too. And I would, from what you wrote down here, that's what I would be covering is both Lyme and for the Lyme germ Borrelia and treating the Bartonella as well, too. Okay? All right. Good luck to you, Thomas. Hello, Lynn. Let's see, Dr. Ross. After listening to you talk about the slight increase in likelihood of developing a second autoimmune disease by taking a vaccine, if you already have one autoimmune disease, our family is planning to get the COVID vaccine. We are wondering, though, about other less crucial vaccines for one of our family members. Would you recommend that a young person with autoimmune disease get a flu vaccine? And would your recommendation be any different if they have two autoimmune diseases? All right, so everyone, I have recommendations out that I put out for the COVID-19 vaccine. And I do believe that the majority of people with Lyme disease should get the COVID vaccine because it's a terrible illness to get that could kill you and might even leave you with permanent damage, okay? If it doesn't kill you, we're seeing people with ongoing fatigue from it. We're seeing people with ongoing brain dysfunction from it. It's a horrible illness, all right? Now, when I recommended getting the COVID-19 vaccine, I was skewered by anti-vaxxers in the Lyme world that basically said there's not enough safety data on it. And I agree, there's not full safety information yet. But when I weigh out the risk and benefits, there's greater risk of dying and getting harm from COVID-19 than I think there is risk of harm from the COVID vaccine. Now, keep in mind, they did do safety studies, okay? What we don't have in those safety studies, and I think the safety studies look good, to be honest with you, but what we don't know is they didn't include people with Lyme, so I can't tell you exactly what happens with people with Lyme. What I did raise in my article when I talked about whether to get the COVID-19 is there's some situations where you may want to consider, okay? Number one, if you are a person that has gotten vaccines that has terrible reactions to them, then you might want to reconsider getting the COVID-19 vaccine because there's a chance you might have a terrible reaction to that. Okay, there's a chance, okay? Number two, if you are a person that has had severe allergic reactions to vaccines before, you may want to reconsider that, okay? And then number three, there's a small relative risk if you have autoimmune illnesses of getting another autoimmune illness when vaccines are given. This is vaccines in general, okay? All right. So it's a very small increased chance, okay? All right. But it can still be there, okay? So those are the points I raised. Now, the one thing that I will say is the flu vaccine, I usually recommend to people with Lyme not to get it if they have active Lyme. And that is because we see so many people that get flu vaccines that tend to get a lot worse for about a good month, 2 months, 3 months at times, okay? Keep in mind, I know the public health authorities are recommending the flu vaccine this season because they don't want you to get the flu and also get COVID at the same time because it could be a terrible double whammy, okay? And I understand that. The thing I would say, though, is it's very interesting this year in that the flu that is up here in North America would have come to us from South America. That's usually how it gets here, okay? And with all the blocked travel, there just isn't much up here this year. Secondly, because what we know from South America is that they had a light flu season this year because everyone's wearing their mask, okay? So wear your mask. I don't understand all you people that are out there that are anti-mask people. I just do not get. It is something that does have science behind it that shows that it can prevent COVID. I think anyone that's out in public, if you're not exercising at least, should be wearing masks, okay? And so that also decreases your chances of getting the flu as well, too. So even though the public health authorities are worried about people getting flu this year, I think the chances are pretty small. I mean, if you're wearing your mask out there in public and if you, because there's just less flu that got up here from South America this year, probably a light flu season, okay? And in addition, the flu vaccine in people in Lyme often sets them back pretty far, okay? They'll eventually recover from it, but it can set you back pretty far. Regarding other vaccines, I don't tend to see the negative effects from them. And so the other type of vaccines, I would consider if I had a patient, like as you described, I would consider getting the other vaccines, okay? All right. So anyhow, those are my thoughts. Let me do a quick screen share because many of you may be thinking, where is my article on the COVID vaccine? Keep in mind, my comments too about the COVID vaccine are based on the 2 vaccines that have been approved so far here in the States, which is the 2 mRNA vaccines, the one by Pfizer and the one by Moderna, okay? I don't yet have an opinion on the AstraZeneca that was recently approved in the UK and some other places because I just haven't been able to look at the safety data about that. It is a total different mechanism, okay? So here's my article called, Should I Get the COVID Vaccine? Should you get it? The COVID vaccine and Lyme disease, okay? That's where I review the science and talk about relative risk, etc. Okay? All right. Hello, Diana. Let's see. Thank you, Dr. Ross. My question is about, oops, I think we already did this one. Yeah, we did. Looks like it was there twice. Hello, Brody. Let's see. I know co-infections are common with Lyme and post-Lyme. Have you seen tonsil swelling or headaches with patients? So tonsil swelling is nothing I would say specifically says Lyme or Bartonella or anything to me. In other words, I don't consider it to be a symptom that is specific for Lyme. There's many other things that can lead to that. Regarding headaches, oh, and then do I see much tonsil swelling in Lyme and co-infections? No, it's not a common symptom at all. Headaches are very common. If you tend to be predominantly frontal headaches, sometimes that occurs in Babesia, although it can occur in regular Lyme. Bartonella is known for giving kind of head pressure kind of headaches, full head pressure. And Lyme can also give you kind of just whole head headaches. Lyme is also known for giving a lot of neck pain, headaches that start as neck pain that come forward with cracking of the neck. Lyme can do that as well too. So yeah, headaches are quite common. Thanks for a question, Brody. Hello, Gail. Hold on here just a minute. I swallowed something down my throat and I'm a little itchy here. Just a second here. All right, let's try this again. Happy New Year, Dr. Ross. Happy New Year to you too, Gail. Thank you. In regards to COVID vaccine, I have Lyme and Bartonella Perigenics and Galaxy for at least 15 years. Both are pretty undertreated, as I don't tolerate any treatments well. Anytime I get even a little sick, like with a cold, I end up super sick for months. My immune system is totally dysregulated, especially at these times. My labs show that I do have a positive ANA, and my RNP antibodies are elevated. No other autoimmune antibodies have been elevated. It has been like this for about 12 years. I believe the ANA is being caused by chronic infections. No rheumatologist has ever diagnosed me with lupus or arthritis or Sjogren's or anything. They say RNP is nonspecific, and I don't seem to really have enough symptoms of any of the various diseases to give me a diagnosis. They have not said I have mixed connective tissue diseases. Do you think my positive ANA and RNP antibodies and knowing how dysregulated my immune system is, should I get the vaccine? It's a good question. So I can't tell you yes or no, but I can just raise some things. I think you have to make a decision, okay? So when the point that I was raising in my article is that when people have autoimmune illness, and yes, you've got some autoimmune component going on, that's why you have anti-nuclear antibodies elevated, okay? There is some autoimmune component. The data tells us is that vaccines can increase the risk of another autoimmune illness, if you have one, by a relative risk of about 1.1 to 1.2. Okay, what that means is, let's say that rheumatoid arthritis, and this is off the top of my head, this is not a correct figure, I'm just giving you an example, okay? So let's say if rheumatoid arthritis occurs in 5% of the US population. To be frank with you, I don't know what percent of the U.S. population has rheumatoid arthritis, but let's say there's a 10% risk that you could get rheumatoid arthritis, and I know that's really wrong. It's way less than that, okay? But if there's a 10% risk you could get rheumatoid arthritis, and vaccine for anybody, whether they have an existing autoimmune illness or not. Let's just say there's a risk of 10% that you could get rheumatoid arthritis. And now you have already another autoimmune illness, and we give you the vaccine that gives you a relative risk of getting another autoimmune illness of 1.1 to 1.2, all right? What that means is, remember I said, let's say for the sake of discussion, rheumatoid arthritis, 10% of all people have a chance of getting it. A relative risk of 1.1 means you still maintain that 10% chance, like anyone else does, of getting rheumatoid arthritis. And you have an additional 10%. 1.1 means you have the normal chance of getting it, and the 0.1 means another 10% risk. So if you have a 10% chance of getting an illness, you have 10% risk of getting arthritis just because you live, rheumatoid arthritis, okay? and your relative risk goes up by 0.1, that's another 10% risk. So 10% of 10% is another 1%. All right. So now your relative risk of getting rheumatoid arthritis goes from 10% to 11%. That's what a relative risk means, okay? In other words, a relative risk of 1.1 to 1.2 means you have a small increased chance of getting the illness over what the normal rate would be. But it's still small, all right? So I want to let you know, I think rheumatoid arthritis is probably less than 1% of the population. So you might go up to 1.1%, okay? You'd have to investigate what the real rate of the illness is. My point is that I'm trying to make here is that, yes, there could be a slight increased chance, a relative risk of 1.1 to 1.2 of getting another autoimmune illness, but you have to look at the relative rates of any autoimmune illness are quite small. And you're only increasing it by another 10 to 20% over what the normal rate is, okay? So for most people, even though I raised the point that you should talk to your doctor to see, given that you might increase your chances, is it a good idea for you to get the vaccine? And I still would say you need to talk to your doctor because I can't give out this kind of direct advice here. I would say that it's probably a small chance that you're going to get harmed with another autoimmune illness. And given how bad COVID-19 is, in general, a person in your situation, even with some of the immune dysfunction you've said, I probably still would recommend that you get the COVID-19 vaccine. All right. And the reason is COVID is so horrible in what it could do to you. Okay. That's the reason. I'm not saying that the COVID doesn't carry any risk of hurting you, the vaccine, but I am saying there's probably a greater risk from harm of getting COVID if you don't get vaccinated. Okay. Or vaccinated. All right. Okay. This may all be very confusing. I hope I made some sense there to everyone. All right. Good luck to you, Gail. Hello, Sherry. Thanks for your help. I have mold, mycotoxins, candida, Babesia decani, and Lyme and Bartonella. Currently, I get very sick and have difficulty functioning if I take nystatin or diflucan. I have a lot of detoxin binders, but I feel stuck. I cannot tolerate any killers very well for these infections. Any recommendations to move forward or possible reasons I can't handle die-off? Sherry, I'm trying to decide how to handle this. For me to give you the best response, this is a situation where I need to ask you a lot of questions and try to get a better understanding of what your reactivity looks like to give you the best advice. Okay, I'm just going to start by saying that, okay? But in general, when somebody has a lot of sensitivity like you're having, I find getting yeast out can help. And I also find that treating for mold toxicity can help as well too, all right? But how do you do it, all right? So if you're very sensitive, sometimes you have to go with extremely small doses of medications to start to treat. You can't go full doses if you're extremely sensitive like you are. So my major comment I would say to you is go very, very low and slow. Now, specifically for your situation, I would need to do a lot of discussion with you. And obviously we can't do it in this setup. One thing you could consider if you want to get more direct advice from me for your specific situation would be to set a visit up to talk with me. And so let me just show you what I have available for that or how you would do that. All right, so my clinic, you can link, I have linked my clinic here. And you might want to take a look. I have two different options that are telemedicine options. And you would find those available to you here through my appointments page. All right. And the two that I offer are something called full medical service and something called limited consult service. Okay. The full medical service means that once we can start traveling and there's not a lot of COVID out there, that you would agree to come in and see me one time in my office. And if you do agree to that, then I could prescribe for you, all right? The other one is a limited service where you think there is no way I'm ever going to come out in Seattle to see you. and in which case I can still give you advice, but you would need to have another physician who would implement that advice. Read both of these sections thoroughly, including cost information here, what I require in terms of forms here, and make your decision as to which way, one of these ways you would want to visit with me. And if you do decide to go forward with that, you can click this Book Now button, which will take you to my online scheduler. Okay? All right. Good luck to you, Sherry. Hello, Marta. Hi, Dr. Ross. I appreciate the exclamation point there. Thank you. Thank you for doing this. I recently had a big battery of lab work after 5 years of treatment for Babesia decani as well as for Lyme and Bartonella. I just got positive fish results through IGeneX. I have taken every malaria med known to man, including Crintofol and quinine, as well as 7 months of IV clindamycin. Wow. I felt much better this summer and focused on treating Bartonella and Lyme, but all the symptoms returned this fall. Do you think that a positive fish result could indicate I got rebitten? I also got positive IgM results for tick-borne relapsing fever and Lyme. Okay, so first of all, remember I said earlier that you cannot rely on knowing where you are by doing testing that looks at how your immune system works, okay? So how the immune system works tests are elispots, Western blots, and immunoblots, okay? A fish test, though, is a direct test that tells you, is the germ in you? And we can do fish testing for Bartonella and for Babesia, and what it stands for, fish stands for fluorescent in situ hybridization. What the heck does that mean? Well, what that means is that in the lab, they take a fluorescing agent that attaches to the genetic material of the germ so that when you look under the microscope, you can see all these little fluorescing things. You can see germs, basically, okay? It's a way of marking the germ so you can see it. Now, for both Bartonella and for Babesia, you got to have quite a bit in you for even the fish test to see it. So having a negative fish test does not mean a germ's not in you, but when you have a positive fish test, it means the germ is in you, okay? So you definitely have the germ in you. Now, is it because you got rebitten? Maybe. Or it could be that even the extensive treatment you have done did not work. And I have no way of knowing, okay? The treatment that I tend to like to use for my patients that are having a hard time recovering is, and I don't have it actually in my Babesia article, but is to use something called primaquine along with quinine or Plaquenil. And the primaquine would be 2 pills 1 time a day, coupled with either Plaquenil, 200 milligrams twice a day. Plaquenil is a quinine derivative, or you would do quinine pills. I believe it's 300 milligrams, 1 pill twice a day. That tends to be the treatment. I find that often when everything else is failing, we'll get somebody better, okay? That doesn't mean it's going to work in you, and your doctors may have already tried it too, but I'll just throw that one out, okay? Then, IgM testing for Lyme and tick-borne relapsing fever. So IgM would be either through an immunoblot or a Western blot. It's an immune system test to see, are you making antibodies that attach to the germ, okay? So it's an immune test, all right? All right, now, let me speak about Lyme, and then I'll say something about tick-borne relapsing fever. So IgMs, whenever you develop an infection, the first family of antibodies you develop are IgMs, okay? And in all infections, what is supposed to happen, did you hear the word supposed to? Okay. What is supposed to happen is IgMs are supposed to go away by around 3 months to 6 months, and they're supposed to get replaced by IgG. We know in Lyme, though, Lyme infection, not tick-borne relapsing fever, but in Lyme infection, it appears that about 40 to 50% of people that have chronic Lyme symptoms, the IgMs never go away. We don't know why for sure it happens. There's theories, but it's a real phenomenon. Okay, so having an IgM positive for Lyme does not tell you if it was recently acute or not. Okay, the only way it might tell you if it's recently acute is if you had a tick bite near that time that you know of. Okay, but keep in mind IgMs can be there in Lyme, Borrelia Lyme, just because for some reason in some people they don't convert over to the IgGs. Now, that same situation might also happen in tick-borne relapsing fever, TBRF, but I don't know. There's nobody that's documented it with science. So I'm not sure when I get back an IgM that is positive on tick-borne relapsing fever, I recognize, because I know for Borrelia Lyme, people can keep making IgMs. I wonder if it can happen in tick-borne relapsing fever, Borrelia too, but I don't know for sure. Okay, so it could be it's old, could be it's new. I just don't have any data, scientific data that helps me understand that. Okay, all right. Good luck to you, Mark. Hello, Lynn. Let's see. Our daughter is about to move into an environment where her risk of COVID exposures will increase. What do you recommend as prophylaxis against COVID? Anything to support the immune system? So I have written about this. In fact, I think I reposted my whole COVID-19 article about 2 or 3 weeks ago. Let's go look at it together. Okay. So okay, so what I want to let you know is there are no proven ways through research that adequately protect you from COVID, but there are some things that might work. Okay, so let me go through that here. Okay, so if you were just to write up here COVID or coronavirus in my search bar, you'll find this article. Okay. And it looks like I updated that on December 18th. Okay, so this is pretty current, all right? Okay, and in here I talk about various things about COVID-19, but one of the things I talk about is what do you do to protect yourself, all right? So don't forget to do the things that everyone should be doing, and that is practice physical distancing. Try to stay at least 6 feet away from people. Don't go to bars. Don't go to restaurants, but be safe. And don't be in environments where there's a lot of spit drops around from people screaming at each other over their drinks that you're going to breathe in and get sick. Okay, that's number one. Number two, wash your hands, although I will be honest with you, that's probably not the biggest factor that prevents it these days. Number three, avoid touching your face. I still agree with that. But the biggest one is wear a mask. So your daughter should not forget to wear a mask and to practice social distancing. Okay, avoid parties, avoid bars, etc. All right. Okay. The next thing that might be beneficial is to support the frontline immune system that deals with germs that a person has never seen before. We call that the innate immune system. Okay. And there are some things down here I recommend that are known to support the innate immune system. Be aware, no one has done any research on COVID to say, does this work? Okay. These are things that might help. Okay. So you can take a look at those things here. All right. If you should get COVID, you want to limit inflammation caused by cytokines. And I mentioned that here. Okay. So in terms of what do I recommend? Number one, don't get in contact with it. I just reviewed that with you. Okay. Number two, do things to boost your immune system, like getting 7 to 9 hours of sleep, and don't deal with, try to avoid stress. All right. Use supplements to support the innate immune system. Okay. And again, as I've said, there is no proof that these help COVID-19, but in theory they should. Okay. So one of those is being on something called transfer factor multi-immune. It specifically turns on a type of natural killer cells which are part of your innate immune system. Reishi mushrooms, beta-glucan, sugars in mushrooms, especially reishi mushrooms, are known to turn on a broad range of innate immune system immune cells, and so I recommend that. Vitamin A might help. Vitamin D definitely can help. There's good studies showing that it limits viral infection duration no matter what the virus is, okay? Probiotics might help, and then also being on either N-acetylcysteine or glutathione, okay? So these are some things you can do. I know that's a lot. Essential ones would be probably the reishi mushrooms, the vitamin D, and the transfer factor, okay? All right, now, if a person were to actually get exposed, then I might do quercetin and zinc. The reason is zinc has a good mechanism by which it may actually, if it can get inside your cells, it can block one of the enzymes involved in virus replication. The quercetin actually helps the zinc get inside your cells, okay? Now, if you have actually a known exposure to somebody that has it, the other thing that might be helpful is to be on a drug called ivermectin. Ivermectin is an antiparasite, but appears to have some antiviral properties. And there is extremely limited, poor quality studies that say that it might help. And so I have been recommending that if you have a known exposure. That's the other thing I'm recommending, okay? So anyhow, take a look here. You'll see the things I recommend, okay? It's a pretty thorough article. It's a long article, but I give you good information, okay? So to all you anti-maskers out there, wear your mask. Protect me, protect the people around you, and protect yourself. There probably is some. The majority benefit from masking is to prevent your spreading to somebody else. There actually is science that says that you can get some benefit of preventing you inhaling it in as well too, okay? All right, so don't forget to do that, okay? All right, good luck to your daughter. Hello, Mary. Let's see. I'm wondering about muscle pain and spasms in neck and back. One have said it's dystonia, others not. No turn or twist of my neck. For me to say if it would be dystonia, so dystonia means you get these muscle spasms that will hold your body in a certain position, which is why you're saying no turn of the neck. Okay. Usually a muscle group will pull and which can turn your head permanently in an area. It's also possible to have dystonia that is not turning your head, but the only way I would know is if I felt here in your neck and it felt like there was a lot of stiffness. That would be the only way I would know, okay? In terms of things that you might use, you could try magnesium. Sometimes magnesium, about 600 milligrams a day might be helpful, okay? That'd be about the main thing I would think of. If that doesn't work, you could try antispasmodics, prescriptions like Scalaxin, Flexeril sometimes can be helpful. Robaxin, these are prescription methods to do it too. Okay. Good luck, Mary. Hello, Stephanie. Let's see. Hi. Can you please talk about the cause and treatment for internal vibrations associated with Lyme disease? Thank you. So, the treatment for the internal vibrations usually is to treat for Bartonella in addition to Lyme. My own sense of it is that this is something that is triggered by Bartonella, leading to irritation of the nervous system, probably an area of the brain called the limbic system, although I don't have solid science behind that, okay? But I find the vibrations to be more specific for a Bartonella as opposed to Lyme, although Lyme might cause it. And the treatment is get the germs under control, all right? There is not a specific other treatment that I have found that will get them under control. So like using anti-seizure medicines, using different herbs and supplements, I don't find those to really be helpful. What I find to be helpful is get your germs knocked down, okay? All right. Good luck, Stephanie. Hello, Athena. Let's see. Why do you prefer to treat Lyme and co-infections with antibiotics since Dr. Horowitz studies indicate almost all patients relapse and these microbes are known to hide intracellularly? So I disagree with your interpretation of Dr. Horowitz studies. Dr. Horowitz has basically done studies that look at what to do to help cure people that have been shown to relapse. He hasn't done studies that look at what the actual relapse rate is. Okay, and if we look at his study specifically using a regimen of dapsone along with rifampin and doxycycline, if you can tolerate those, he's showing some evidence that about 40% of people get into remission. Okay. My own experience is that if we look at what works best, and this isn't just me, okay, if we look at what is the best way to get somebody better with Lyme, if we look at so a group called LymeDisease.org, the California, which used to be the California Lyme Disease Association, they're now called LymeDisease.org as of a few years ago, has been conducting an ongoing study or has an ongoing study group that is called My Lyme Data. Anyone can sign up to participate in it. And when you sign up, there's a bunch of questionnaires you're going to fill out so that they get a sense of who you are. They periodically go back then and take selected groups from that filled out the questionnaires and ask them follow-up questions as part of a research project, okay? So last year, their 2020 project, that is, was looking to see what is it that got people better. And they, of the 12,000 people in their database, they studied about 4,000 of them. And they just asked them information, trying to figure out what is it that you did that got you well, okay? And they considered things like rifing, herbal antibiotics, ozone treatments, everything. They looked at everything, all right? And what their study showed is that the people that had the greatest chance of the people that got well or had marked improvements, the thing that got them there overwhelmingly was long-term antibiotics of a year or more. Okay, that's what the data tells us. Okay, now I know people have all kinds of feelings about antibiotics, and which is what I kind of gather you're trying to do here. But if you look at what works, their data says it is not all the alternative stuff like rifing or ozone treatments or hyperthermia, any of that stuff. What it is antibiotics, and also being on herbal supports as well too. Their data did not break down whether they did not look specifically at using herbal antibiotics as your antibiotic choice. Okay, all right. Now you can take a look at the study yourself. All right, and in fact, I've looked at that study, and I looked at I wrote an article that involved that study, as well as a study they did the year before about alternative medicines. Do they work? Okay. And the answer is some do a little bit, some not so well. So let's go look at all that information together. All right. So let me do a quick screen share here. Okay. And all right. Now, so I was going to type here what works. All right. So it's an article I wrote probably about 2 months ago now. And what it talks about is success of prescription alternative medicine Lyme treatments, okay? And so you can read through this article, but anyhow, what they showed is that more well patients and high responders report using antibiotics, and the duration that gave the best improvement was a year or more, okay? That's what their data tells us, okay? Right. Now, I also want to let you know they have previously looked at alternative treatments, all right? And of alternative treatments, stem cells only help 3% of people. Hyperbaric oxygen helps about 22% of people. Colloidal silver, 34%. Rife machines help about 35%. Anyhow, you can read this whole chart to see what about alternative treatments, okay? But of all the things that people try, it is antibiotics for a year or more when it comes to the Lyme germ. That is the thing that gets people well, okay? And I disagree with your interpretation of the data that everyone relapses. That is not true. And that is not what I see in my practice either. Okay. Now, I want to let you know that as of this last year, a lot of people are using disulfiram also to help treat persister Lyme. Their data did not look at, it was not done over the time period when everyone started using disulfiram. So it's hard to say what the impact of disulfiram is here. Okay. All right. So the reason that people use antibiotics is it's what works, period. But you got to be on them long enough. Short term doesn't work. You're sometimes talking a year, 2 years or longer. Okay. The other thing that I want to let you know is that if somebody's not getting better, we have to look beyond the Lyme germs. We have to think of mold toxicity. We got to think of too many yeast. We got to look at a bunch of other stuff too. Okay. All right. So anyway, that's what the data tells us. And Horowitz basically, so not all patients relapse. That is just wrong. Horowitz is correct in looking at that. Yeah, you need to use antibiotics to get inside of cells. Intracellular antibiotics tend to be the best ways to do this. Okay. All right. Thanks for that question, Anita or Athena. Excuse me here, everyone. Hi, Natalie C. Do you have any experience with Daraprim, and what do you see with it? Do you see it work well against Babesia? I'm actually not familiar with Daraprim. All right, so I can't answer that. Hello, Stephanie. Let's see. My daughter took your online test for yeast overgrowth and scored way over 140. What do you recommend she do next? Thank you. So for ideas, you could take a look at my article where I tell you what to do to treat yeast. But if there is a high yeast screening score and people have symptoms of yeast like gassiness, bloating, sugar cravings, maybe pimples or acne, etc., then the treatment, my starting place that I like to work with is either herbal or prescription. The prescriptions tend to work quicker and work better, and that would be to do a combination of nystatin and diflucan for at least a month. Those are the prescriptions, okay? Herbal, and that works about 90% of the time. The other option would be to go herbal. I usually like working with an herbal complex called Phytostan. It's made by a company called Integrative Therapeutics. And Phytostan is made up of a number of herbs that can kill yeast. It's made up of powder coke, caprylic acid, rosemary oil, thyme oil, and I think indolacinic acid is in that. It's 2 pills twice a day in adults. I don't know how big your daughter is here. And it works about 80% of the time, but will take 2 to 3 months. Okay. All right. Let me just do a quick screen share. I'll show you my articles on yeast. All right. So take a look at my yeast section here. And again, take a look at my article called Kills Yeast, a Brief Guide. And in here, I talk about azoles and nystatin. So diflucan that I mentioned is an azole. Nystatin is nystatin. Okay. I talk about my herbal mixture complex here, and then there are some other options that I lay out down here. Okay. All right. Good luck. So I already answered that question. Try to get rid of that. Hello, Charlene. Let's see. Happy New Year, Dr. Ross. Happy New Year to you, too. Let's see. I read the book Bitten by Chris Newby, and at one point she stated immune system molecules in the blood that are unique to people with Lyme disease. There was no other information about this. Wonder if true. Could a blood test let you know for sure if you have Lyme, or is this too complicated? As always, thank you. So it's interesting. So there is there is an exploration going on at this point about, are there certain molecular or immune system markers that are a unique fingerprint, if you will, for having Lyme in you. All right. And if that is so, if there's certain chemicals or certain blood findings that only show up when you have Lyme and the Lyme germ is in you, and then as Lyme goes away, those chemical markers go away, that could be evidence of a cure. All right. So there is exploration going on right now of looking at what that would be. And it's actually something we're looking at in other infections as well, too. So an area of medicine that is evolving. There's a fancy name for it. I forget what it is. But so I think that's what she was referring to. That testing does not exist yet, though. Okay. I think experiments are going on looking at this, but the testing is not out there at this point. All right. Thanks, Charlene. All right, everyone, that's it. It's been good to be here with you again tonight. Tomorrow morning, when you get the email from me, it will have an edited version where I basically clean out the initial part of this video that, well, anyhow, I got to do a quick edit. I won't tell you why, but I need to do a quick edit. And that'll happen here later tonight. And hopefully it's all ready to go and loaded up on YouTube for you tomorrow morning if everything goes as planned, okay? I also will provide you a brief summary of what we talked about in terms of what the major topics were, so you can look and see if you want to look at this again, okay? Anyhow, when you get that email tomorrow morning, there's also going to be a link that you can sign up for next week's webinar. So we're doing 2 more of these this month, okay? So next week and the week after. So I hope you'll sign that up. The other thing I ask you to do, share the information about these webinars with family and friends and people you know with Lyme that you think could benefit. If you're getting benefit, they'll probably get benefit as well, too. All right. Trying to reach as many people as possible to help people recover from this horrible illness. All right. All right. Good night, everyone. And I look forward to seeing you next week. Bye-bye.